Let's go over neuropsychiatric symptoms of chronic infections in kids, sometimes labeled PANS or PANDAS. PANS is pediatric autoimmune neuropsychiatric syndrome. PANDAS is pediatric autoimmune neuropsychiatric disorders associated with a streptococcal infection or strep infection. If you look up the criteria for these diagnoses, you will see that it says sudden onset of symptoms. That doesn't have to be the case. It can be a gradual onset, a building of some of these symptoms or all of them, depending on how sick your child might be. One of those symptoms is defiance. Sometimes kids will get a diagnosis of oppositional defiance disorder when they really have an infection helping to cause the symptoms. That doesn't negate opposition and defiance that's brought on by things in their lives or lack of discipline, but really we're talking about oppositional defiance, which is a much stronger reaction. And then you might see a decline in math skills in your child. That sometimes is just looked at as maybe a processing disorder, which it can be, but it might also be caused by an infection. Separation anxiety, now that's in kids that are old enough that you wouldn't expect it, or it's an onset after your child doesn't have separation anxiety anymore because they grew out of it. But speaking of growing out of things, baby talk. Sometimes kids will get to 8 or 9 years old and suddenly they're presenting with baby talk again. If that's in conjunction with these other symptoms, let's go looking for a cause. Another one is texture sensitivity. That can be taste or things in the mouth. Like one of my kids could not handle bananas. All of a sudden, another one couldn't eat carrots. Just things that popped up out of nowhere. But texture sensitivity, some of these can be lifelong because we'll talk about how children can be born with some of these infections and some of these issues. But texture sensitivity can also mean you can't have socks with a seam in the toe, or pants have to be only a certain kind of pants, or maybe the kid only can wear leggings or certain soft underwear because they cannot tolerate that texture. Here's another one, changes in fine motor skills. So that will mean if your child has had nice handwriting, it declines gradually and you can't find another explanation for it. Let's talk about that. Another one is tics. These can be motor tics. They can be verbal tics, just about anything. It can be, the blinking of the eyes repeatedly. It can be making a face. It can be a hand gesture, but it can be words. It can be any number of things that show up as tics. And then obsessions. As your child developed an obsession for something new, maybe this child didn't have obsessions before. Also look at compulsions. If your kid says, I can't help it, and they can't explain what's going on, that might be a compulsion. Another criteria is actually potentially anxiety attacks. And again, think about, these are kids that might have been confident before that started having anxiety attacks and you can't find a trigger. So in counseling and therapy, we go looking for a trigger to certain behavior. But when there's an underlying infection that's causing the symptoms, then you may not be able to find a trigger to that anxiety. It's just happening, and that anxiety might last a long time. Here's another one, aggression. This goes with that oppositional defiance diagnosis, but sometimes these kids aren't necessarily defiant. They're just aggressive, and it's out of nowhere, and you can't really explain it, and you try discipline, and they're not responding. Let's go look for an underlying cause of infection. And then here's one. I've heard parents talk about school refusal. Teachers will sometimes say, educators, etc., and I understand where this comes from. They'll say, well, that child just needs more discipline. You should just drag that kid out of the car and take them to school. But when you've got a kid who absolutely can't stay in school and there's something you can't put your finger on and you can't find anything concrete that's wrong, you just can't make them go to school, then let's go looking for infections. So that's a list of neuropsychiatric symptoms of PANS and PANDAS. It's not an all-inclusive list, and you don't have to have all the symptoms, but that's some stuff I need you to think about and consider for underlying infections.